Doc, how you doing today?
I'm doing fantastic. Thanks, Dr. Vo. Really appreciate you having me on. I think we've got some great opportunity to help your viewers figure out strategies to get back to the new normal.
Absolutely, absolutely. And the new normal, right? I mean, every single day it just seems like there's a new regulation. There's something different that they want us to do. They're going to let us do this and then take it away. It's one of those times that, really nerve-wracking. And I'll tell you what, as someone who practices in Texas, it was business as usual starting on Monday. But there was so many different restrictions. We could only see one patient at a time. We had all these different things we had to do. And I wanted to bring you on here because number one, you have a lot of insight. You've been practicing dentistry for quite some time, but you had some insight on how to tackle this new normal. But before we go any further, okay, I know who you are. A lot of our viewers know who you are. But for the off chance that we have a newer dog who's got through the graduate, I call it the speedy graduation, right? They're like, here you go, you get your DDS, you're out the door, right?
Right.
For those who don't know who you are, can you just briefly just introduce yourself and your connection and actually how you started OnPharma?
Sure. Yeah, happy to. So Mick Falkel is my name. I'm a general dentist in Monterey, California. I still practice dentistry. I've been in practice for over 30 years. About 18 years into my practice, I was really kind of fed up with the way local anesthetic worked.
Mm-hmm.
I had a personal tragedy in my family. I had a child pass away, and that's a horrible dark hole to go down into. And so I was a chemist before I was a dentist, and I wanted to start keeping my mind busy just to keep it off of my problems. And so I started working on a solution to the problems I was having with local anesthesia. And those problems really were, number one, I was taught in dental school, if you can give a comfortable injection, you can build your whole practice around that.
Yeah.
And I worked really hard on my technique. And I kind of got known in town as being the guy who gave the comfortable injection. But I still had people, as soon as the anesthetic would start going in, so I could fool them with the needle. But as soon as the anesthetic would start going in, they would wince. And that was a chemical problem, not a technique problem.
Right.
So I wanted to try to fix that. I also really hated local anesthetic failure. I took it personally when anesthetic failed. Turns out it's not my fault. It's the patient's fault. I just didn't know that then. And then the last thing, and probably the most important thing that we're going to talk about today, is I really hated giving anesthetic and having to go find something else to do while the patient was marinating. And right now we can only see one patient at a time, as you brought up. And so we're going to talk a lot about that. But I wanted anesthetic to work like a switch if I could. Kind of give anesthetic and be able to go to work in a very timely manner, so I never had to leave the patient.
I love that.
And
I love that.
That ended up being what we call today seat, treat, and complete, because that's the way we kind of have to do it for a number of reasons. One of which is the PPEs, right? We're all at a shortage of PPEs.
Mm-hmm.
We need to be able to treat the amount of patients that we want, so we have to be able to conserve on those. Jumping from room to room to room and donning and doffing PPE equipment every time is just not going to work. So if we're going to see one patient at a time, we don't want to sit down and have to wait 5, 10, 15 minutes till they're numb. We want to be able to get to work right away so that we can finish our job and move on. And by the way, if you're uninterrupted, you're like 30% more efficient. So not only are you saving the time period that you have for waiting for anesthetic, but you're also more efficient in the job you're doing. So now you can move from patient to patient to patient, which is of severe advantage to the patient as well, because the less time they're in the office, the less opportunity they have to get infected from cross-contamination and various things. So back to me, I started this about 18 years ago. So I'd like to say I'm an overnight success. It's just 18 years. And so I've been working, very hard. We've got a great team at OnPharma. It's a product that I hope you and your viewers will seriously consider to help you through the new normal, because I think it's going to be a key to being able to keep your practice volume at a position that's going to allow you to run your business with some level of profit.
I love that, and I will say this, that the last time I had Dr. Malamed on, and he was talking about buffering anesthetic, and Craig was on as well, and I actually kind of slap on the hand from Dr. Malamed because I told him that I was basically like a mad scientist at my office and just buffering it myself. And he was saying, look, he was like, look, Glenn, you know, yes, you can probably get away with it once in a while, but it's not controlled. You know, you're not, you know, what your buffering solution is not the right concentration, all these different things. And it's so much easier using a product like Onset. Okay. And so we're going to discuss basically the science behind that. But before we go any further, guys, if you like what you're hearing right now, if you like Mic's philosophy here about tackling this new normal, do me a favor and type in the comments section Onset. Okay, go ahead and type in the comments Onset, and maybe I can convince him to give us a nifty deal. Okay, so type in the comments section there. But I want to go back to what you said earlier there about tackling the new normal. But now we have to kind of, in Texas, we have to see one patient at a time, and then we can move on to the next one. So what I'm used to is numbing a patient, getting up, going over here, doing some hygiene checks, maybe seat a crown, do something else, and then come back. Now we can't do that, okay? And so that 5 minutes, or maybe that 10 minutes, okay, or however long it takes for the patient to get numb, how is Onset, let's talk about the science behind that. How does that enable a practitioner to get their patient numb faster?
Sure. So, on a very high level, the way local anesthetic works, it's packaged as an acid. The reason it's packaged as an acid is it's for shelf life, if you will. But it doesn't work as an acid. The body has to convert it to a base before it can go through the nerve membrane, which is lipid soluble, requires a base. And then once it gets into the nerve, it can do the things that it does to block the impulse. That period of time, when you put it in as an acid until the body raises the pH to the point where there's enough anesthetic to block the nerve, is your latency period. What we do at OnPharma, or with buffering anesthetic, is we're taking sodium bicarbonate, which is our body's buffer. We've created the sodium bicarbonate at the perfect pH. Sodium bicarbonate is a very volatile compound. And what we did is we figured out how to control it so that it's exactly the right pH for every cartridge that you're going to deliver. You're going to take 3 seconds or so to put the bicarbonate into the cartridge of anesthetic, raising the pH up to physiologic, which is 7.4. And now when we put it into the body, we've already done the work that the patient used to have to do for us. So that's why, a patient can cause the failure, because on any given day, any given patient may or may not be able to buffer the anesthetic. But if we put it in at physiologic pH, we know we're going to get a result that's desired. And that enables anesthetic to go to work in a minute or two, as opposed to anywhere from a minute or two to 20 minutes, right?
Yeah.
I mean, and sometimes it doesn't go to work, right? We don't quite get them over the threshold. I'm sure you've had patients that you couldn't actually get numb. And right now we have difficult patients to get numb because, in California, unlike you in Texas, we're not back to work except for emergent procedures.
Yeah.
And so all of those emergent procedures either have severe infection or severe inflammation, both of which we help with, because, if a patient has an infection, quite often you can't get them numb at all.
Right.
So, and the reason for that is the tissue has a pH as low as 5.0 in infection. Well, if we put in anesthetic at 3.5, the highest it can go is 5.0. Well, there's nowhere near enough base at that low pH in order to get numb. So what do? We send them home for a few days on antibiotics. The antibiotics does not fix the dental problem. It just lowers the infection so that maybe the tissue becomes normal enough physiologic pH that we can get the patient numb. Well, if we put the anesthetic in, if the infection's 5.0, we put the anesthetic in at 7.4, well, now we have a chance of getting that patient numb. And so we can do the work right away. So what we've found is that the practitioners that are using Onset are actually able to treat their patients very efficiently and effectively during the pandemic as well.
Well, and let's just talk about the things that, you said one thing there, and that was you're going to save some time for yourself and time for the patient. But we're not even talking about all these other things that you're going to save. And you were saying it earlier, PPE, right? I mean, if you only have so many gowns, right? And in this group all the time, people are asking, okay, do you have any masks? Do you have any gowns? And think about it. If you can maximize the time with your patient comes in, has an emergency, and you can get them numb, and you can see them right then and there. saves time, saves money, it saves your precious resources right there. So I want to ask you something before we jumped on. I was talking to Dr. Falkel about how I practice dentistry pre-COVID, right? Sounds really weird saying that, but pre-COVID, and what I'm going to have to do post-COVID. And you were telling me about, seeing one patient and being really efficient there might be something that I want to start considering. Talk about that. Talk about kind of seeing the new normal now, seeing one patient and being really efficient and focusing on one before jumping on to the next one.
Great. Well, I've been doing that very protocol for the last 10 years. And I will tell you, in my office, I had a practice management consultant come in and watch me work. And essentially I was doing what we're talking about, which is giving anesthetic and then going right to work. And she watched me do that. And she said, look, I can save you an hour to 2 hours a day if you learn how to schedule around that. And I said, well, in my particular case, I said, well, that's great, but I'd rather parlay all that time up and have more days off a week. So I took a 4-day, very busy dental practice, very busy, very productive, a very profitable practice. And I brought that down to 2.5 days, same volume, but now I'm only doing 2.5 days a week. So I took that time. So if you take that and say, okay, well, I was doing that just because I'm an efficiency guy, but now you apply it to the new model of COVID, I will tell you that your stress goes down and your productivity goes up, your overhead goes down. All of those happen because of efficiency. And like I said, that efficiency is this time savings is not just your anesthetic latency time. It's that you're saving, which you are, but it's also being uninterrupted. Glenn, you're a pretty busy guy, it looks like, and you have little kids at home. I do a lot of writing. And if I'm at home and I'm writing and my kids are interrupting me all the time, it takes me forever to write something.
Oh,
yeah. In the office and nobody's there, I write it in 15 minutes. And it's no different. Dental procedures are just a project. And if you're uninterrupted during that project, you're more efficient. So time shows that over and over again. So now, it used to be that we tried to, at OnPharma, we tried to convince people that seeing one patient at a time was more efficient and more effective and more profitable. And I think we were trying to solve a problem nobody had. But we all have the problem now because we can only do one patient at a time. And this is just a way that we have a lot of data. I mean, literally hundreds of our dentists that have converted to that have been, they say the same thing as me, which is if you told me I had to work without buffered anesthetic and go back to the old norm of moving around, I would just say, you know what, I've done this long enough. I don't want to do that anymore because the stress level goes down. Profitability goes up. Patient volume, in this case, is going to be able to be maintained so that you can run your business. I mean, all of these things that are trickling down to us every day that we have to figure out how to mitigate in the new normal, we have to have some solutions. And this is just one solution. But I think it's one.
And you know what? I mean, all of us, we're kind of in the same boat now. Just how I had another live stream. I was telling everyone that everyone's had to adopt a startup mentality again. I mean, they're starting from scratch. They have to get patients. They have to do all these different get them all in. And right now we're going through this model where we're seeing one patient at a time. Well, what better way to really get more efficient in that model and seeing if it works for you? And I'll tell you what, we have someone here in the audience that just said, seat, treat, and complete. Sounds easy to me. So they definitely agree with you right there. And guys, if you like what you're hearing, type in the comments section onset so that we can get a nifty deal for you guys if you want a nifty deal with that. And also, if you have any questions for Dr. Mick, go ahead and fire away right now. So I'm going to go back to kind of like how the onset system works. I'm a big fan. I've been using it since the old delivery system. And when Craig came on, I was so excited because the new way is so much easier and so much easier to work with. But let's talk about how that works because it really is easy to use. I know you have you actually have a special prototype, right? That you have right now, the new version, right? Can you hold that? You mind holding that up for us real quick?
I don't mind holding it up. It's actually just a different color right here.
Oh, okay.
It's not new. But let me ask you a qualifying question before we go on.
Sure.
When you say the old system, do you mean you were doing it yourself, buying sodium bicarbonate and doing the little mad scientist thing, or what?
So I actually had the older cartridge, the old onset system, and then I kind of got frustrated with it because I would use it, and then I had to use it like right away, or else the shelf life. And so then I started doing the mad scientist way, and then when I got connected with Craig's like, we got a new system, Dr. Vogt. I promise you you'll love it. I met him at the Southwest Dental Conference. I got a kit. I started using it, and I was sold. And I said, okay, when can I get you on? And that's when we brought Dr. Malamed on. And now I'm so lucky to have you on now. So for those who missed that episode, I wanted you to kind of discuss how it works for those who are new to this.
Sure. So buffering local anesthetic is, you can do it a number of different ways. What we did at onset that's significant is like I've already mentioned, we've taken our bicarbonate, which you can see on the screen on the left of us, and it comes in a package of 4. And when you open that up, you put it into the pen, which you see on the right, and it's good for a week, 7 days. So you can use it over a 7-day period of time. So the cost, if you will, is $12 a day. Okay, so you can mitigate all these problems for $12 a day. Well, I don't know about you guys, but out here, a gown is $12. A disposable gown is like $12 now. So, anything we can do to save money is great. The last piece of the puzzle is what's sitting at the bottom, which is called the cartridge connector. And the cartridge connector just gives you the ability of take your cartridge of anesthetic, and which has a fixed volume. You can't just add to this. You have to add and subtract. And it allows us to do that with the pen. So when you're ready to give anesthetic, you take the cartridge of anesthetic, you put it into the pen, and then you turn it and push it together. That connects the cartridge of bicarbonate with the cartridge of anesthetic. You dial the dose, which for all anesthetics is 9. So there's a little dial here with 9 on it. You can't see it. Dial there with 9 on it. And then you push the button. Now you reverse the steps, and you take that and put that into your cartridge of your syringe, your dental syringe, and give anesthetic like you always have. Now, for best results, you want to buffer the cartridge, place it in the syringe, and use it right away. And the reason for that is when you put together sodium bicarbonate and hydrochloric acid, which is the acid inside the cartridge of anesthetic facility, it liberates carbon dioxide. And carbon dioxide, I call it the secret sauce. And it's a gas, though. So you only have about a minute to get the benefits of carbon dioxide. And so if you want maximum benefits, you want to buffer, put it in the syringe, and go ahead and give the anesthetic. In my practice, my hands are in the patient's mouth. They can no longer talk anymore. And that's when they buffer the cartridge, put it in the syringe, hand me that, and I go right to work. Once you're done, you take the anesthetic out. Sometimes they're numb before you even get the needle out. They'll go, how come I'm so numb already? It's never happened before. And, then it worked. I will tell you that, you're still going to miss your blocks. But now in 2 minutes instead of finding out at 10 or 15 minutes.
Oh, yeah. And
right?
Imagine how much time you save.
That's a time suck, right? So if you've missed your block and you can only see one patient at a time, guess what? You're behind for the rest of the day. So, this is an opportunity in 4 minutes after a missed block, you're in the right spot. Now, I would recommend you go to a different place, a little higher, a little left, a little right, a little north, a little south. Don't go back to the same spot. And you'll probably be very successful on that second injection. And now you know right away. So, it's a pretty simple system. So you're going to have to invest a couple of things. One, you're going to have to invest some money, which we'll talk about, a Nifty Thrifty deal before we get to the end of this. Number two, you're going to have to invest a little time. It's a very little time in training for you and your staff. And then number three, you're going to have to invest 3 seconds to buffer the cartridge of anesthetic. And with that little bit of investment, you get all of those benefits.
Well, 3 seconds of time investment, you're going to get back how many minutes, Doc?
It could be hours a day, to be honest with you. So, it's one of those nice, and I wish all my financial investments, I could invest 3 seconds. If we turn that into dollars and cents, that would be really nice. But here is one of those examples where you can invest a small amount of time with a big dividend.
Now, I want to ask you a question. This is directed towards the other mad scientists out there. Like I said, I was one of those guys there. And after I talked to Dr. Malamed and realized that it's a lot more efficient, right? More efficient, save time, and actually over in the long run, save money by using this system. For those who are still kind of buffering their own anesthetic, why don't you explain why it probably won't be as efficient as opposed to using a system that already measures everything out.
Sure. So quite a few things that I'll touch on. But number one, in this day and age, if it's got to be about infection control.
Mm-hmm.
And if you've got a whole bunch of syringes just to get that amount of bicarbonate into your cartridge, that's going to be trouble for you right away. So that's number one. Number two, you have all of the costs of those. If you add them up, you're paying just as much as you are for this, and you've got a system that works with every anesthetic, has been tested, it's been used literally probably 10 million times in the United States, so it has a tremendous safety record. And then the bicarbonate that you buy, like I said earlier, it's a volatile compound.
Yeah.
And if you use it at the wrong pH, and you really have no idea what that pH is, and it changes each time you put a needle in and take it out, now all of a sudden you're going to get varied results. Well, if you want varied results, you already have that with local anesthetic. Okay? And if you're going to go through all of this and sometimes have it not be, as good as possible, why have you gone through all of those problems? Right. So, if you put it together and you can use a system and you like cartridges and you like our stainless steel syringe, which has a tremendous amount of feedback, this is a great system for you.
I agree. And it's exactly what happened with me when I was trying to buffer my own anesthetic. The results were variable. Sometimes it worked really good. Sometimes it didn't. I would get mad. I would get frustrated about it. And also just having different little syringes to move things over and whatnot. I had to get extra supplies. And this is so much easier. It's just one thing. It's consistent all the time. And like I said, I wanted to address that because there's probably other people who are watching or just like me a few years ago where I was doing it by myself. And now it's so much easier. This is a shortcut, guys. Literally, that's what it is. It's a shortcut to save some time with patients, but it's also a shortcut to get them more numb. Now, we have a question from the audience. Let me put this on here. And this is an interesting one. The question is, would this also change the amount of discomfort a patient would experience during the injection?
So, yeah, I mean, that was like I said earlier, my number one focus is patient experience. Mm-hmm. And if I can give a comfortable injection, then I'm going to be able to build my practice around that. So the reason that buffering anesthetic can give you a more comfortable injection is you're no longer injecting essentially the pH of lemon juice. So if you think of it, the needle's going in, it's creating a wound, and then you're dumping lemon juice on it. Okay. And so I like to say, like when I go to the beach and I'm having a heaven forbid, a Corona beer right now. But if and I always put a lime in there. And if you have a cut on your cuticle, now you need the general anesthetic because you got so much pain. but that's what we're doing with an injection, right? Like I said, sometimes you can fool them with the needle going in, but once the anesthetic bathes that wound and it's an acid, it hurts. The other thing is if you're giving anesthetic, and if you buffer your anesthetic and you use it right away, like I said, and you have the advantage of the dissolved carbon dioxide in solution, and if you just have the weight of your thumb on the plunger as you're advancing the needle, let's say for a block where you're going in a substantial distance, you can anesthetize the path of the needle along the way. And that makes that injection significantly more comfortable because, that needle's going in for a long way. If you compare that to 2 or 3 or 4 millimeters with a infiltration, a block has a significant, path that you could anesthetize along the way, which, dramatically changes the pain that patients feel.
I love that. I mean, I'm learning all these things. I've been using Onset for quite some time. Guys, if you like what you're hearing right now, if you want a nifty deal for the Onset system, type in the comments section. Show us some love. Onset, type it in the comments section. Okay, Doc, I'm going to ask you this question. Okay, so you've done all these studies, all the Dr. Malameds of the world, all these different clinicians that love your product here. Now, I want to ask you best practices because we actually have a lot of new grads that tune in during this time. They actually got an early graduation, so they're trying to get a head start on clinical dentistry. So we have for a new grad who's listening right now, okay, and they want to learn. Okay, I want to learn the most comfortable way to give an injection. What would your advice be? Obviously, we're going to talk about Onset as well, but from start to finish, what is your protocol of giving a comfortable injection?
Okay, well, first of all, what I would say is let's make it easy first. And if you're just starting and you wanted one trick to help you give the most comfortable injection, I would just use buffered anesthetic.
Yeah.
Because virtually any technique can be controlled with pain control during the procedure if you just buffer the anesthetic and use it appropriately. And so if you use it right away and you use it with your finger on the plunger as you're advancing, I teach a technique where I personally don't use any topical anesthetic.
Really?
Yeah, and the reason I don't is, I do a lot of surgery, but for the most part, I'm a restorative dentist, like most of us that are probably listening to this call. And saliva is a great thing, unless you're doing restorative dentistry. and if you taste something that tastes terrible, then it starts the faucet of saliva. And so if I can use less things that taste terrible, then I'm going to have less saliva in the field, if you will. So for me, that I don't. And plus, it's just one more step. And again, I'm an efficiency guy. So what I do is I keep the tissue as taut as possible. So I pull the tissue taut. If you can put your finger on the plunger so lightly that you just get a little ball of anesthetic advancing in front of the needle and touch the tissue for a few seconds, and then shake that tissue as you're passing through, that is your topical. Okay. Now you don't want it to drip in the mouth because local anesthetic tastes terrible.
Yeah.
Okay? But one drop, they're not going to taste. It's just going to go onto the tissue. It sits on that tissue for a second, and then you move forward. And that's a great technique to eliminate topical anesthetic and to get a comfortable injection, and then buffer it just like we talked about. Use it right away. So from the time you push the button here to the time you're starting the injection is a minute or less, and you'll get all of the benefits of dissolved carbon dioxide in solution, which can be your topical anesthetic as well. And then any other technique you want to add in is great, but you really don't need them.
Yeah.
There's lots of techniques, for mitigating injection pain. One is heating the anesthetic, shaking the tissue vibration and so forth, going slowly. You pick and choose all of those that you want because you want to give the appearance to your patient that you're doing the best for them, so that they go out and they market your practice for you because you didn't hurt them. So number one thing patients are afraid of is the injection.
Yes.
Number one. Number two is us hurting them during the procedure. So they're actually more afraid of the injection than they are of hurting them. Well, if you can control those two as an early practitioner, you're going to have a huge successful career.
Yeah. I mean, that's the most it's nerve-wracking for the patient. It's also nerve-wracking for us.
Oh, yeah.
Like, oh gosh, I don't want to hurt this patient. Oh, are they feeling it while I'm working? It causes you to kind of tense up and lose focus.
Or jump. When they jump, everybody jumps. Everybody. What I say is somebody jumps in the dental office, everybody's day is ruined. Right?
Oh, yeah.
My day's ruined. I got sweat running down the back of my neck. Yeah. Right? The assistant's flustered. They've got to regather themselves. And the worst person is the patient because, pain is the number one way that they interrogate people. Well, it shouldn't be torture to go to the dentist.
Right.
We have the ability to give them a perfectly comfortable experience. Now, one last piece of the puzzle that I think is really important if you want to be super successful, and that is that you test every pulp before you start drilling on a tooth.
Like a endo ice or something? Endo
ice is exactly the right thing to use. You could use an electric pulp tester. They're a little kludgy. You got to put you got to put some toothpaste on the tooth, and then you got to electrocute them, and that's old school. You want to use endo ice. And if you wonder what it feels like, so you just put a cotton pledget on cotton pliers, or you can use a Q-tip. You want it as fluffy as possible for surface area. Squirt the endo ice on it, put it on the cervical margin of one of your teeth, and you'll know instantly whether that tooth is vital. Well, if you do that for a patient on infiltrations, any injection, if you can leave that on the tooth for 5 seconds, they will not feel your dental procedure. And now you're assured of a successful visit.
That is amazing advice. Actually, I actually got that from Dr. Moneyback, and I love it. It's such amazing advice because the thing is you number one, you take the doubt out of your head so that you can just really go in there and focus. But number two, patients really appreciate it each time I do that. They're like, oh, wow, my last dentist just went in there and just had at it. You know, you actually made sure I was numb. I'm like, yes. Yeah. And I mean, a cotton applicator and a little bit of endo ice, come on, you know, for that, and that for them to feel comfortable, that's priceless.
Well, yeah, for you to feel comfortable is priceless. You haven't been doing it as long as me. Look at how much hair I've lost.
Oh man, I love it. I love it. So Doc, let me ask you this. Okay, so you talked about anesthetic, and everyone is assuming using lidocaine, but actually with Onset, you can use other anesthetic as well.
Yeah, you can use all. So we have five flavors with 9 different variations of local anesthetic and cartridges in the United States. And what I would tell you is you can buffer them all with one simple number on our pen, and that's 9. You just have to remember 9 on our pen, and that's 0.09 mLs. And the only cartridge that I wouldn't buffer is bupivacaine. That's Marcaine, or the long-acting anesthetic.
Why is that?
Well, there's 2 reasons. Number one, it's extremely lipid soluble, so it can precipitate. Okay. And although, you know, I could give you numbers that it wouldn't allow it to precipitate, the way you should be using that anesthetic, it's a terrible anesthetic for focal anesthesia. It's a fantastic anesthetic for pain control after a long, difficult procedure. So the way you should be using that anesthetic is giving it topping the patient off at the end of a root canal or surgery or whatever, so that they don't, you know, the most inflammation and pain we have post-operatively is in the first 12 hours.
Right.
You can get up to 12 hours of soft tissue anesthesia with bupivacaine, but you also want it to last as long as possible. So why buffer it? Follow me? You want the patient's body to have to work for that one so that it lasts as long as possible. So bupivacaine, by the way, is 0.1% of the market. So you can buffer, if you just think of it, you can buffer all your anesthetics and just don't buffer Marcaine, and you're fine.
Yeah. Lidocaine, Septicaine,
and you know, get the results that you're hoping for with whatever flavor of anesthetic you choose.
And so Septicaine?
Yeah, Septicaine is Articaine. Yeah. So Septicaine is a brand name for Articaine. You know, that's a very large portion of the market. And, you know, there's what's great about Articaine is a couple of things. One, it tends to go through tissue a little bit better. And number 2, it has 1 to 200,000 as well as 1 to 100,000 epinephrine. So 1 to 200,000 is 100% dilution over 1 to 100,000. So if you have somebody that has some cardiac issues, or you don't need them to be numb quite as long, you can choose the 1 to 200 variation of the epinephrine, and that's a great opportunity for your practice to have as a way to help you with, you know, your anesthetic protocols.
Right, right. I love it. Now, you know, we've had a lot of different, you know, vendors, docs, CE instructors, a lot of different guests during the shutdown here. Everyone's had a little bit more time. They had time to come on. And my question, I always ask them, there's always a shortage of something, right? So I had some companies on and they were talking about masks and face shields and different things, and everyone has a shortage. Do you guys have a shortage of Onset?
Well, that'd be a great problem for a business to have right now.
It is a great problem, yeah, but right now, if we really want it, it's.
So no. To answer your question, you know, our supply chain is intact, excited for the increased usage that we're already experiencing because so many people are going to adopt Seat, Treat, and Complete, and we're going to have no problems with that. So you will not expect to have any shortage. I would say that if you're going to buy Onset, you know, during this period of time, it may be nice to get started so you get your training and you're ready to go the very first patient that comes back. If you're still seeing emergencies, you'd have it for that advantage. But it's not because it's going to be in short supply. We'll be fine.
Okay. I thought I'd ask that because there's different, you know, people need different components and whatnot to put things together. And if there's a shortage somewhere down the supply chain, then it could affect the final product there. So I'm glad that you guys don't have any issues there, because definitely, I if you guys had a shortage, I would probably have to message you privately and tell you, make sure you have a stash ready for me. But, you know, as far as OnPharma goes, you're in the Nifty Thrifty group here, Doc. And everybody I bring on, I always ask for a Nifty Thrifty deal. And so hopefully a lot of people are excited about buffering anesthetic. Obviously, the new norm, seeing one patient at a time, you got to be really efficient. You can't be going and doing a hygiene check while someone's getting numb for 5-10 minutes. You really need them to be numb and jumping in right away. We totally get that. So, Doc, I'm gonna put you on the spot. What can you do as far as a nifty deal to help all our viewers out there right now?
Well, Glenn, I'd be happy to give your group a special deal, if you will, a nifty thrifty deal, I think is what you call it. Great. We're going to start off with 10% off,
Right.
which is great, and then free shipping, which is significant. But the most significant thing we're going to give you is 100% money back guarantee. So you buy the starter kit at your 10% off, and you get 80 tries. So that's enough for 80 injections. I don't think I know for a fact that you will know whether you like it or not in 80 tries.
Okay, so I have to stop you right there because I'm not sure if I heard you correctly. So I'm going to have you repeat yourself. And Craig, if you're watching, I'm so sorry, but Doc let the cat out of the bag. So I need him to repeat himself here. I just want to make sure. So we have you recorded here while everyone's watching. Did you just say that you guys are going to offer a money back guarantee?
100% money back guarantee, and you have 3 months to try it.
Wow. Okay. So you're going to give everyone an opportunity to try it. You guys are so confident that it's going to change their practice, like it changed mine, that you're giving a money back guarantee. And you said 80, one cartridge is about 80 injections.
Exactly. So the 4 cartridge system that you have in the disposables ends up to be 80 cartridges of anesthetic that you can buffer. So to get that 100% money back guarantee, you just got to do 2 things. One is allow your staff to get trained. It takes 15 minutes, and you wouldn't want to not be trained on something anyway.
Yeah, you didn't know how to use it.
And then number 2 is if you decide you don't want it, we just want a few minute call so that we understand why, and then so we can always improve. And so that's all it takes in order to get the 100% money back guarantee. So what I would tell your viewers is, we have a lot of things in front of us. And we have a lot of hurdles, and we've talked about them today. The big ones are we have to reduce the amount of PPEs, be able to see only 1 patient at a time. We have to don and doff like we've never done before, and so we want to stay with that patient. So we need to be able to maintain practice volume, and then we also need to be able to create our chain of infection control that's as solid as possible. And that's not just for our patients' benefit. That's for our staff's benefit, and that's for our benefit and going home, our family's benefit.
Yeah.
We're still learning. We, being the general populace in medicine, is learning about this coronavirus. It's significant. And if we want to be as safe as possible, we want to see 1 patient at a time, and that's our opportunity to make that efficient. So what I would say is, you're kind of crazy if you don't try Onset right now.
Oh yeah,
that money back guarantee. So
the money back guarantee.
Get it, get trained, get your staff excited, get excited about it yourself. And I think what you'll find on the other end of this is the silver lining is, if we go back to a time when we can go back to where we were pre-COVID, you won't want to.
Yeah.
You'll want to see 1 patient at a time, because I'm here to tell you, after all of these years, I wouldn't practice without it. So that's the silver lining. Learn how to do it under duress and find out that it was better than what you were doing before. Yeah. That's pretty cool.
That is amazing advice. And guys, I'm going to let y'all know the nifty deal for Onset. I've been using it. I love it. I'm a big fan. The new system it is so easy to use, but they're going to give you the training. Okay. You don't have to worry about that, but the nifty deal is 10% off. You get free shipping. That's here. But the one that I've never heard before, is the money back guarantee. And all they ask of you guys is to do the training. And if you don't like it, just tell them why. Maybe there might be something that you did wrong that they can help you with, or maybe, if you don't like it, they can improve there. That's the only way they can improve. So that is a super nifty deal. Doc, we had a question just slide in here. Can I put up another question for you?
Yep.
And I know they're asking twice. I'm going to put it up here. Okay. So this doc wants to know, okay, so what anesthetic do you recommend for a mandibular block? And how long does it take for the patient to get numb using Onset?
Okay, so for mandibular blocks, I'm comfortable using any anesthetic. There's a controversy around 4% anesthetics. That's Prilocaine and Articaine. That's a controversy. I'm comfortable with that. However, my primary choice of delivery for an inferior alveolar nerve block is buffered mepivacaine. So not bupivacaine, mepivacaine. So that's 3% it depends on the brand name, but carbocaine, pilocaine. It's without epinephrine. And I give that anesthetic first, and then I give a buccal infiltration if I'm doing a molar or a bicuspid with articaine. And I do those two, and I get very close to 100%.
And how long is what's the duration time for the patient to get numb when you do that with onset?
So I think, so you asked duration time. That's
how long does it take for the patient to get numb?
Yeah, so I'm starting that procedure. So when I take the anesthetic, when I take the needle out, they're already handing me my pledget of endo ice, and I'm putting it on the tooth. As soon as they stop feeling it, I'm picking up
rock and roll.
I'm picking up my whatever instrument it is, and I'm going to work. So that can be anywhere from as soon as I get the needle out to 1 or 2 minutes. If they're not stone cold numb at 2 minutes, then I was just far enough away. I need to give them another injection in another location. And then within 2 minutes, I'm going. So in a worst case scenario, it's 4 minutes.
And you know what? If you weren't buffering it, it would normally take you about 5 minutes. Just doing that one time,
No. So if you look at statistics, and I can share that with your group if you'd like to, I don't want to get too nerdy on you, but if you look at statistics for mandibular blocks with either articaine or lidocaine, and they're exactly the same, at 15 minutes, only 67% of your patients you should expect to have focal anesthesia.
Oh gosh.
Okay, so the good, I like to present that to help people, especially the young guys, because I went for years thinking it was my fault that they weren't numb in 5 to 7 minutes, because 5 to 7 minutes is what they say on the package insert. It's what Stanley says in his textbook. Malamed says in his textbook. It's not true. That's for soft tissue anesthesia. Well, soft tissue anesthesia doesn't allow me to go to work comfortably. So if you're looking at pulpal anesthesia, 67 or 2/3 of your patients should be numb at 15 minutes. That means 1/3 of the time you should be expecting to fail.
Wow.
And it's not your fault. It's the patient's fault.
Wow. And can you imagine going through that with the pressure?
Yeah.
So COVID times right now.
You're still going to miss, but anatomic misses are less frequent. So failure is usually associated with the patient's physiology. So know that, you're going to know that you've missed within 2 minutes.
I love it. Man, that's really helpful for a new grad to hear. Now, let me ask you this. For those who want to take advantage of the Nifty deal and get the onset system, what is the best way? Is it going to the website ordering? Is there a phone number? And do they just tell them about the Nifty deal? What's the best way?
Yeah. So the best way is to go to the website, which is OnPharma.com. So OnPhar.
We'll put that in the comment section later.
.com. And we do have a phone number. If you want to speak to somebody as opposed to order online, you can call that up, and we've got people there that will take any of your calls and are experts on answering any of your questions. But you can actually order online. I think you're going to give them a code. And so if you want to make sure that everybody has the code, then you'll get the deal that we talked about, your Nifty Thrifty deal. And you can get that either when you're speaking to one of our customer service representatives or via the internet ordering.
Well, Doc, before I let you go here, everyone that I bring on, I always ask them for a piece of advice to kind of get through the situation that we're going through. Everyone's dealing with it in a different way. And so I've been asking all my guests, whether it be a personal piece of advice or business advice, what kind of advice can you give those who are watching right now who are dealing with this kind of unprecedented situation, how best to manage it?
So I think the primary advice I would give you is seek, treat, and complete. If that motto is going to really help you be as safe, effective, productive, and keep your sanity during what we have coming up as the new normal. So I think that would be my biggest piece of advice. My secondary advice would be, I was trained during the AIDS epidemic that came up, and I went to dental school in San Francisco, where the height of that epidemic was. I was the very first class in my dental school that had to wear glasses, a mask, and gloves, so universal precautions.
Oh.
The very first. The class behind me, they were sticking their hands in with no gloves on, and that just repulsed me. But that was the new normal then. Well, did you practice this that way before you had COVID? Did you? You always have.
I always had eye protection, gloves. Yeah.
So I don't think this is going away with the additional PPE equipment that we're going to have. And if it does, it's going to be quite a long time. And that's okay. It's going to make us better. But my advice is get used to it. Don't think it's going away too quickly.
Wow, that is great advice, especially for someone who's been practicing for as long as you have. And if you've been thinking about just adopting this philosophy of seeing patients, I mean, I have to right now, because that's what the state of Texas is making us do. And who knows, I mean, if that's how things are, you might as well get used to it, and you might as well be very efficient in seeing each patient. Dr. Falkel, it's been a pleasure to have you on. I was super excited when I got Craig to bring you on. So thank you so much for jumping on. And everyone who's watching, thank you for tuning in. Keep a lookout. I'm going to put in the comments section how to get the deal. And we'll see you guys next time. Doc, we'll see you later.
Hey, take care. Thanks, Glenn. Bye now.